Hi, my name is Brittany Robertson, and upon the completion of my Master's of Public Health degree from St. Ambrose University, I will be going over my applied practice experience and my integrated learning experience showcase. For my APE, I had the opportunity to serve the Cleveland Department of Public Health in Cleveland, Ohio as a community engagement intern for the Office of Mental Health and Addiction Recovery. My APE supervisor was Samantha Holmes. She is the program coordinator for the Office of Mental Health and Addiction Recovery. She has a staff of three, two counselors, and one peer supporter. Samantha had gave me the responsibility to continue her work of abstracting and collecting data from coroner's reports that she received on a daily basis from the Cuyahoga County Medical Examiner's Office. I would abstract the date of when a decedent had passed, the location, the age, who found the decedent, was there any paraphernalia found on site, the mental health history, the physical health history, and if there was any substance use history documented, that would also be collected. I also had the opportunity to engage with stakeholders and community partners through attending regularly scheduled meetings that were hosted by the Ohio Department of Health, the City of Cleveland's mayor's office, divisional meetings within the Cleveland Department of Public Health with the Division of Health Equity and Social Justice. I would also attend weekly meetings with the Office of Mental Health and Addiction Recovery leadership and staff. But through all of these meetings that I was attending, I was documenting what was being said, if there was any relevant findings, new updates, what trends were different agencies and organizations finding and reporting on. Also look for opportunities of where we could collaborate with another agency or organization. And then we would also compare the different findings and compare it with what we're finding and seeing in our office to help us make decisions if we're on the right path of what we're doing, or if we need to pivot and be of service or utilized in a different area. For my ILE, I was interested in presenting a program proposal. I was able to utilize my Faithful Steps program proposal that I had did in a previous course, and for my APE. So I ended up taking that program proposal and making changes, investing more time to improve the program, organizing it, and providing a clear vision to what the program is and how it should be disseminated. The program goal is to create a faith-based community program devoted to preventing fatal drug overdose among African American males 45 years old diagnosed with a substance use disorder in Cleveland. As I mentioned in the previous slide, that I kept, it was a reoccurring thing of seeing African Americans in the coroner's reports that I was reviewing. So I knew I wanted to focus on African American males still, and then um, I also noticed that there were or a significant amount of older African American males who were um, found deceased due to a fatal drug overdose um, in some other months, not on the month posted in the previous slide, which is July of 2023. And basically, the overview of the program um, is was to plan a faith-based program for African American males living in Cleveland who deal with substance misuse. The program would be conducted at the J. Glenn Smith Center in the Office of Mental Health and Addiction Recovery, where that location is. Half of the building is designated for the Department of Public Health, and then the rest is designated. The other half of the building is designated to a county medical center called Metro Health. So the Metro Health system occupies one half, and then public health, the Department of Public Health, we occupy the other half. So if there are any emergencies, we could get participants to a health professional within minutes because they're right next door to us. And then, so I just thought that was just the best place to facilitate the program. And also, the program will be administered by the staff from the Office of Mental Health and Addiction Recovery. Samantha Holmes, my APE supervisor, would lead the dissemination and implementation of the program. Her two therapists would assist in completing participants' intakes, and then whoever the participant sees at their intake will be their therapist for the rest of the duration of the program. And then the peer support, they would be in charge of hosting our our group counseling for brotherhood development. And then we would also have a community spiritual leader come in and do a spiritual workshop. So there will be 6 months of preparation for the program. Program administrators would receive a stigma reduction training, and then also they would be recruiting participants. At the start of the program, the duration of the program would be 12 months. And the start of the program, participants would complete intake. Our intake process is an opportunity to identify what level of care an individual needs and can we facilitate it. If the level of care is higher than what we can provide the individual, we will refer them out to another health facility that we are in partnership with, or that is close to where they reside, to where the participant resides to. And then participants that first intake session will count as their first counseling session, and then they will receive 2 counseling sessions a month, and then they will receive 1 group session. They would attend 1 group session during a week the week that they don't have one-on-one counseling, and then the following week out of the month that they don't have a group, that they don't have one-on-one counseling sessions, that they don't have a counseling session, they will attend a spiritual workshop. And that spiritual workshop will strengthen their spirituality, help them use their faith and spirituality to develop coping skills and strengthen their coping skills. And then at the end of the program, 3 months after the program has ended, participants will receive a follow-up counseling session, and then 3 months after that, another follow-up counseling session, and then 3 months after that, they will receive another follow-up counseling session to help us determine the effectiveness of the program. And then by the end of the program, we would encourage participants to want to volunteer to become peer supports and participate as a peer support in the following cohort. MPH takeaways and what is next for me. I believe that the St. Ambrose MPH program expanded my perspective on public health. I have a bachelor's in public health, but it's a concentration in health education. I believe that the St. Ambrose MPH program allowed me to prioritize having a worldly view and addressing health inequities by comparing health policies, practices, status, coverage, and statistics across countries. I would not have fostered a global perspective without the impact and guidance of my professors. The St. Ambrose MPH program is comprised of professors who possess a diverse range of domestic and international experiences related to public health. The professors are all inspiring and open to sharing their work in the field. I am truly thankful that they have equipped me with interprofessional skills and technical skills that will support me through the success of my career in public health. What is next for me? I am strongly interested in relocating to the DMV area, Delaware, Maryland, Virginia area, primarily Maryland or DC. I just believe that is a great area for individuals with an MPH, and there are going to be more opportunities career-wise out there than I feel that I have here in Cleveland, Ohio. So in 2025, I do plan on being in that area. I have been seeking fellowships. I'm interested in completing fellowships just because I want to keep practicing, developing my skills on composing programs. That's one of the things I enjoyed out of the MPH program is developing programs, and I just want to continue investing in that skill after graduation. And then I've been applying. I also have been applying to federal agencies. I still work for the Department of Veteran Affairs and have been applying for transfers out in the areas that I want to um, reside in. But I've also been applying to the Health and Human Services, the NIH, and other roles within the VA that align with uh, public health.